Hey, I'm Umansky, the Lawman. A lot of our clients who are going through car accidents and other cases need the services of a pain management doctor. And many of you guys don't know what a pain management doctor is. So today, I have the fortunate ability to have my friend, Dr. Javier Placer, who is a pain management doctor, kind of explain what a pain management doctor is, what conditions they treat, what procedures they use to treat those conditions, and what you can expect as a patient when you undergo those procedures. First of all, what is a pain management doctor?
Well, pain management doctor is exactly that. We manage the pain after certain conditions. It could be traumatic, or it could be something that people develop because of the aging process. But in this case, we want to talk about the traumatic events after possible motor vehicle accidents or falls.
When you've been in an accident and you've had a traumatic incident with, for instance, a car wreck, what are the common injuries that you see as a pain management doctor that flow from them?
Yes, there's many, but as an interventional pain physician, I do treat a lot of spine, neck, low back, mid-back injuries. We do a little bit of shoulders and knees as well, but pretty much all we do is interventional procedures, trying to do procedures to assist in the recovery.
What are the conditions that flow from a car accident that you typically treat?
Yeah, the most common ones that we see is neck injury. We can see patients who develop herniated disc after an injury, or the patients who had previous problem and those problems got aggravated secondary to the motor vehicle accident. So they get more symptomatic with the symptoms affecting the quality of life much more. So we do see neck problems, back problems, and even problems within the thoracic spine too. Rare, but we see them.
So Doc, let's talk about the types of procedures that you use. Let's start from the baby procedure to the max procedure.
Good question, and I'm glad you asked, because most of the common procedures that we do, especially with trauma or motor vehicle accidents, is the epidurals, right? When you have the anatomy within the spine affected with herniation or irritation, inflammation in the nerve. So we tend to do the epidural, the interlaminar approach, where we go into the lamina. We use this special needle right here. This is a 20 gauge needle. It has a guide, so it helps me go into that space. I take the guide and I do the loss of resistance that tells me that I'm in that space. Very simple procedure. It takes about 5 minutes to do. It's not that painful. It's truly not painful other than me going through the skin, which we tend to numb it up. And once we're there, we put the medication that we need to inject. Another procedure that we do often here is, and we use this guy right here, is the transforaminal selective nerve block. So we go through the foramen around here. So you can see where the nerve is. This is the nerve root. So we go selectively and inject that area where that disc is probably pressing on the nerve. And we put most of the medication in that area, so it tends to be more effective to address that selective problem when we do the procedure.
What's a trigger point injection, for example?
Yeah, trigger point injections are more simple procedures that you don't need too much of this equipment. You can do it in office. So you just follow the trigger point as you examine the patient, and you inject that scar tissue or fibrotic tissue that patients can develop with the anesthetic and sometimes the steroid.
What can a client expect from the facet procedure? How long does it last? What can they expect? Do they, what do they feel after? Does someone have to drive them home?
Yeah, and that's one of the interventional procedures that we were talking about. We call it interventional because it involves a little bit more of an advanced procedure where we need the CR and we need a special day for that procedure. We cannot do it the same day that we see the patient, so we have to prep them. Once they come for the procedure, we'll place them on their belly on this table, and we're going to be taking pictures as we clean the area. Once we are comfortable with the picture, then we use this needle right here. It's a 3.5 22 gauge needle, and with the C-arm, I'm going to be guiding that needle into the joint, as you can see here. And once I get into the joint, there's a ligament there, and you're going to feel that pop sensation when you get into the joint, and you're sure you're in there. Once you're there, you just take the hub out, connect the syringe with the medication and inject it. And they find relief right away on that one because we use anesthetic, and that's a good sign that we were right on with the diagnosis.
So, and clients or patients, a lot of them have apprehension about needles.
Yeah.
And so, what do you do as a doctor or your team to make them feel more comfortable?
Well, education. We see the patient, educate them, explain how the procedure works, what to expect before and after the procedure, and also they'll be facing down, so they're not going to be seen looking at the needle. I'll be talking to them as I do the procedure, what to expect, so nothing will be surprisingly uncomfortable when I do the procedure.
Are there any other procedures that you?
Yeah, I mean, we this is one of the wires that we use for the spinal cord stimulator. We do it here in the office. I use also Abbott equipment for that.
Who puts in the spinal cord stimulator?
I do it. It's a very simple procedure. We go in with a wire. I'm gonna bring this guy up so you can see. We go into the spine and we guide it all the way up into, using the fluoroscopic guidance live, all the way into the thoracic area. That's where the receptors is in the spinal cord that deals with the pain. And typically we're able to address pain from the lower back all the way into the legs. We do it on patients that failed back surgery, failed injection, complex regional pain syndrome, patients with RSD, that nothing works. I have done this on these patients and the quality of life improved significantly